You go to bed feeling fine, maybe a little tired after a long day at work, but nothing unusual. You check your phone one last time, switch off the light, and tell yourself, tomorrow I will start taking better care of my health. At 3:30 in the morning, while you are deep in sleep, your blood pressure suddenly surges. The arteries in your neck are stiff from years of salt, stress, and sitting. A tiny clot that was quietly building all day finally breaks loose. It travels up to your brain and blocks a narrow vessel. You do not feel pain. You do not wake up. Inside your skull, millions of neurons are silently dying. At 6:30, your family comes to wake you. Your face looks a little different. Your speech is strange. Your right arm does not move properly. They think you are just sleepy, so they wait. By the time you reach the hospital, the window for powerful stroke treatment is already gone. This is the stroke that hits while you sleep. As a cardiologist in India, I see wake-up strokes like this every week. During the day, people are careful, but at night they assume the body is safe. It is not. Nighttime can be the most dangerous 8 hours for your brain arteries. My name is Dr. Heartwise. In this video, I am going to show you how night strokes happen and 7 simple changes you can make to protect your brain while you sleep. No extreme rules, no expensive tests, just realistic habits for Indian life. Stay with me until the end, because the last tip is the one almost every patient ignores, and it is the one that can decide whether you wake up independent or disabled. Before we start, tell me in the comments, what time do you usually go to bed? And how many hours do you actually sleep on an average night? Write it down. You may already see why your risk is higher than you thought. Let us begin with a hard truth. Your brain does not switch off at night. It works like a night shift factory. It cleans waste, balances hormones, repairs damaged cells, and resets your blood pressure for the next day. If anything in this night shift goes wrong, the risk of stroke rises sharply. Many strokes are first noticed when a person wakes up. We call them wake-up strokes. Medicine can still help, but it is more difficult because nobody knows the exact time when the stroke started. So the first rule of prevention is simple. Do not give the stroke a perfect nighttime environment to grow.
Many strokes are first noticed when a person wakes up. We call them wake-up strokes. Medicine can still help, but it is more difficult because nobody knows the exact time when the stroke started. So the first rule of prevention is simple. Do not give the stroke a perfect nighttime environment to grow. The first danger is uncontrolled evening blood pressure. In India, we often eat late, work late, and sleep late. We drink tea at 9 or 10, finish office calls from bed, and then expect the body to magically calm down. But the nervous system is still on. If your blood pressure is already high, the night can become a pressure cooker. If you have been told you have hypertension, you must know your numbers at night, not only at the clinic. Measure your blood pressure at home at least a few evenings every week, around 9 or 10 p.m., sitting calmly. If it is repeatedly high, speak to your doctor. Sometimes we need to adjust the timing of medicine so that protection continues through the night. Never adjust tablets on your own. Along with pressure, the second danger is dehydration. Many people drink very little water in the evening to avoid going to the toilet at night. They may also drink alcohol or very strong tea instead of water. When you are dehydrated, your blood becomes thicker, like syrup instead of water. Thick blood moving through narrow, damaged arteries is a perfect recipe for clot formation. The solution is simple. Drink regularly through the day so that you do not reach nighttime already dry. For most healthy adults, 1 glass of water in the last 1 to 2 hours before bed is helpful. If you have heart failure or kidney disease, always check with your doctor first, but for the majority, gentle hydration reduces night stroke risk. The third danger is heavy late-night eating. A huge plate of biryani at 11, oily roadside snacks, or a second full dinner after a party are not only bad for your waistline. They force your body to digest while it should be resting. Blood flow is diverted to the stomach. Sugar and pressure surge. If you already have diabetes or borderline sugar, this nighttime spike repeatedly injures the delicate lining of your arteries. Try this simple rule. Make your last heavy meal at least 3 hours before sleeping. If you are hungry close to bedtime, choose something light like a small bowl of curd, a few nuts or fruit, not a full solid meal. Your brain will thank you. The fourth danger is sleep apnea and loud snoring. You may think snoring is just a funny habit, but to the brain it can be like someone turning the oxygen tap on and off all night. I once treated a 52-year-old shop owner from Pune. His name was Arvind. He was not very overweight, he did not smoke, and his daytime blood pressure in clinic looked acceptable. But his wife said he snored like a tractor and sometimes stopped breathing for a few seconds in sleep. One morning he woke up with his left arm weak and his speech slightly slurred. He waited, thinking it would improve after tea. By evening he could barely walk. His MRI showed multiple small strokes in the back of the brain. When we did a sleep study, we found severe sleep apnea. For years his brain had been getting pushed into and out of oxygen shortage every night. If you snore loudly, wake up choking or feel unrefreshed in the morning even after 7 hours in bed, speak to your doctor about a possible sleep study. Treating sleep apnea with weight loss, side sleeping or a CPAP machine can dramatically cut night stroke risk. The fifth danger is midnight scrolling. The phone comes to bed, the lights go off, and the blue glow stays. Your brain receives a clear message. It is still daytime. Stay alert. Stress hormones rise, heart rate rises, and the deep restorative stages of sleep are delayed. You may finally sleep at 2 a.m., but the quality of those hours is poor. Poor quality sleep raises blood pressure, increases inflammation, and encourages nighttime heart rhythm problems. It is like silently loosening the screws in the pipes that carry blood to your brain. You do not need to live like a monk, but try a strict rule. No phone and no bright screen for at least 60 minutes before sleep. Keep the charger in another room if you must. Read, stretch, pray, or talk to your family instead. Your brain needs darkness and quiet to reset. The sixth danger is sleeping position. We have a full video on this topic, but let me give you the essentials. Extreme chin to chest posture, very twisted spine, or sleeping with an arm tightly under your head can compress the arteries in your neck and disturb blood flow. For most people, the safest positions are on your back with a small supportive pillow under your neck, or on your side with your spine relatively straight and your chin slightly away from your chest. If you regularly wake up with neck pain, numb hands, or dizziness when you sit up, your sleeping posture might be part of the problem. A good pillow is cheaper than stroke rehabilitation. The seventh and final danger is ignoring warning signs in the morning. This one breaks my heart because I have seen it steal so many futures in India. You wake up and notice that one arm feels strange or heavy, or your face looks slightly uneven in the mirror, or when you speak the words feel thick for a few seconds. You tell yourself, maybe I just slept in the wrong position, maybe it is gas or weakness. You decide to wait. Every minute you wait, more brain is lost. If you ever wake up with sudden weakness, numbness, face drooping, trouble seeing or difficulty speaking, act as if it is a stroke until a doctor proves it is not. Remember the word, be fast. B for balance, sudden loss of balance. E for eyes, sudden trouble seeing. F for face, one side drooping. A for arm, weakness or numbness. S for speech, slurring or confusion. T for time to get emergency help immediately. In India, that means going straight to the nearest hospital with a CT scan and a stroke team, not to a small clinic first. Now let us put all this into a simple night routine you can actually follow. 2 hours before bed, finish your last heavy meal. 1 to 2 hours before bed, slow down your work, lower the lights and keep water nearby. Check that you have taken your evening blood pressure or sugar medicines exactly as prescribed. 1 hour before bed, put the phone away. Avoid heavy arguments and intense news. Do a few minutes of light stretching or breathing to signal to your nervous system that it is safe to relax. As you lie down, choose a posture that keeps your neck neutral and your breathing easy. If someone in your family snores loudly or stops breathing in sleep, talk to them seriously about a checkup. Do not laugh it away. These steps will not make you bulletproof, but they will move you from silent risk to active protection. You will sleep not only more peacefully, but more safely. Let me leave you with one question. If your brain could speak to you before you sleep tonight, what do you think it would ask you to change first? Less salt, more sleep, fewer late-night fights with your phone? Pick one small change and write it in the comments. When you write it, your chance of doing it goes up. If this video opened your eyes about the stroke that can hit while you sleep, do not keep it to yourself. Share it with your parents, your spouse, your friends who stay up late scrolling. One forward from you may prevent a wheelchair for someone you love. I am Dr. Heartwise. Subscribe if you want more clear science-based explanations about your heart, brain and blood vessels. Sleep smart, protect your brain, and I will see you in the next video.